Good evening. Thank you for joining us tonight. Our investigation into state data is pointing to cancer concerns for East Texas.
The numbers show cancer-related deaths happen more here than anywhere else in the state, causing researchers to want to know why. Investigative reporter Julia Janae joins us now live in the studio with more on this story. Julia, what kind of feedback have you been getting from viewers on these statistics?
Well, Anissa, when we broke this investigation on Sunday night on KLTV.com, within hours, hundreds of you were talking to us about it. People who were either affected by cancer personally or their loved ones. It's obviously a topic that's hitting very close to home for a lot of people. And there are state statistics that are supporting what many suspected. Now they're understanding that if they know more than a handful of people who've had cancer, it's not just a coincidence.
She does have pretty hair. Stylist Trelisa Sheridan says she gleans a lot from her White Oak customers.
I hear a lot of people and their stories, and so I knew that there was a lot of cancer in our area.
But when the client trend became her own story,
when it hits you personally and your family, it kind of, gives you a little gut shot.
She determined her kidney cancer diagnosis would have a purpose.
And that was to try to do something more than just hear about it.
Trelisa started gathering names of White Oak survivors for a study 2 years ago.
The people that I know that have died of kidney cancer, there were 4 kidney cancer cases in 2014 that all 4 of us live within a mile of each other here.
She has a list of 50 people she knows.
I think the cause is way more important to find out for people than the cure.
Dr. Paul McGee Hey and other doctors at UT Health want the same thing.
And if you look at all the parameters and put those together, I think it adds up to some serious health risks that people are undergoing here.
Dr. McGee Hey has been following East Texas's lagging health numbers for over 10 years, and he says the research points to these top causes. Number 1, there's more tobacco smoking here. 26% of adults in East Texas smoke, according to a Department of Health study, 7 points above the state average of 19%. Number 2, we're more rural here.
When you're in a rural area, you have less access to health care, you have less access to more nutritious foods. There's a tendency maybe to not exercise as much.
After we first published this story online, hundreds commented on social media asking, is it the water, industry chemicals, or pollutants in the air? So we asked Dr. McGee Hey, is it our environment? He said no.
I think if you look at what's the diseases that are causing us illness and death, they're chronic diseases, namely heart disease, cancer, stroke, diabetes, and certain lung diseases. And they are primarily due to behaviors.
Ready to go again?
This is a room of cancer survivors.
All right. Yeah, this is where I am every Monday, Wednesday, and Friday morning.
Where the belief is movement creates remission.
If people just do modest exercise, the chance of your cancer coming back is reduced 50%.
Dr. Gary Kimmel founded Cancer Foundation for Life that runs survivor gyms across the state. Those taking advantage of the free program, he says, can endure higher dosages of chemotherapy and heal faster.
The nausea, the vomiting, their anxiety, their depression, all these things that we go through when we have a life-challenging disease, all those are significantly mitigated with exercise.
Survivor Boo Eubanks says pushing weights here have helped her push past uterine cancer.
After the chemo treatments, my legs really hurt from the waist down. But once I started walking the 3 miles every day, that went away and I never had that problem again.
And while healthier lifestyles would fix a host of diseases, Trelisa says she hopes researchers will still look deeper.
I think that one of the things that we need to investigate is our water, our environment. A cure would be a wonderful, wonderful thing. But if we can find the cause and nip that in the bud, then you've cured it. You've fixed the cure. And so with that being said, I think the cause is way more important to find out for people than the cure.
What are some of the things? Now, there's a lot of research still going on devoted to this topic. Trelisa says she's going to keep getting info about her community of White Oak, and the UT Health team is looking at population health. They say they expect to release more specific results for East Texas in the very near future. Anissa?
Julia, how does age factor into these results? I mean, could it be that certain older communities have higher rates of illnesses? Is that affecting this at all?
Well, we talked to the Department of State Health Services about that very issue. We were told that the statistics that they publish and that we used in our story are age adjusted to make sure that the comparison is even between younger and older communities.
Okay, thank you, Julia. We've put a link to this data on KLTV.com. Just click on the big red box to check out what the health breakdowns are for your community.